Thank you. So what I was going to about today is grief and the impact on persons with psychosis. And when I started out, I thought about um, talking about grief in general on how someone with a mental illness, how it's affected when you lose an important person in your life. And as I got into it, um, I realized that, and I knew this, but it really came to the forefront, is that grief and psychosis has so many different aspects because we go through, when someone is diagnosed with a mental illness, they have so many other types of grief as well. So when I talk about grief, I'm going to be talking about all kinds of losses, whether or not it's the loss of grandma or being diagnosed and the changes in your health. So kind of keep that in mind as we kind of go through this. The objectives for today, I have four objectives. The first one is just to examine grief as a natural part of life, and it's quite unique and individual to each person. So we got to make sure that we don't judge somebody on how they're actually reacting because everyone's response to grief is different and everyone's response to particular griefs, whether or not it is the loss of a job or the loss of a wife, it's going to be different. So you can't just say people grieve this way when they go through this. It's all different. We're going to examine the relationship between grief and psychosis, how it impacts, how the psychosis impacts the thinking of someone going through grief, and also how grief impacts having psychosis. I want to introduce some techniques used in grief therapy and how they can be adapted to persons with psychosis. And we'll see that CBT is huge in grief therapy and then CBT with psychosis. So a lot of the techniques and the strategies and everything can be used in both situations. But the most important thing that I want to help people with today is so that we can increase our awareness and comfort with um, being able to the pain that's associated with grief and psychosis in order to sit with somebody in their pain so that we're comfortable sitting with them because being able to sit with them and experience it and process what's going on is probably the most important thing that we're going to do. Many people are aware of Elizabeth Kubler-Ross, who during the 60s did a lot of work on grief. And her original work on grief was how the stages and the emotions that we go through when we are diagnosed with a terminal illness. So that's how it started out. And it looks, the first one is shock and denial. When we're told of the loss of the grief, we're like, oh, that didn't happen. We go numb. We can't think about it. And a lot of it is because pain in our life is overwhelming, and people can die from a broken heart. From the pain becomes too overwhelming, the body shuts down. So it's a natural defense that we have to go numb so that we don't experience that pain. We can then move into anger, being angry about what happens, go into bargaining. And bargaining is the if-when statements that we go through. If my son didn't smoke, he wouldn't get lung cancer and he wouldn't be dead. If little kids, if I was a better daughter, mom wouldn't have died. That if then kind of thinking that we kind of bargain thinking if this would have happened, then this horrible thing wouldn't have happened. If you lose your job, if I'd only worked harder, then I would have kept my job. Depression, then we go into depression, and then eventually we can find some kind of level of peace and acceptance for the loss. The thing that's important to remember, though, is it's not a straight linear process. It's not that you move very smoothly from one stage to the next stage, to the next stage, to the next stage. It goes up and down, your emotions are up and down, and you can go from Like in here, you can heightened denial, just everything that's going on, then you can um, go into depression, but you can then go back to anger. So you move back and forth. It's a very fluid process. So when we're working with somebody, please remember that just because one time we see them that they were angry and then the next time they're depressed, you think, cool, we're almost there, we're done. They're moving towards being able to accept this diagnosis or this loss. The next time you see them, they may be back at anger again. So it does move back and forth. Um, One of the things that's really important to understand is I have so many people who come to me like 2 years after a loss, whether or not it is being diagnosed with a chronic health issue or the loss of a spouse or whatever. And it's like, it's 2 years later, I should be done. There is no should be done. Um, this country is known for not wanting to feel pain. We kind of gloss over everything. So when people are feeling pain and discomfort, whether or not it is from being diagnosed and struggling with psychosis, whether or not it's the person themselves or the family member who's struggling with their kid with psychosis or the death of somebody, that is painful and it takes a lot to go through. And people around them don't want to feel pain. They don't want to be comfortable or uncomfortable. If you think about in the how many cultures in the world where they have mourning periods, you wear black for a year, or they're not allowed to do anything for a year. Years ago in this country, people wore black. They wore black armbands to let people know that they were in mourning. And now we're 3 days and done. You get 3 days off work, you need to be back. And if it's your spouse or something, they'll give you like 2 weeks. But then you need to be back to normal. We don't like to feel and know that people are uncomfortable. So when people aren't through their grieving in 6 weeks, they think something's wrong. So that adds to the intensity of the grief. I'm wrong. Something's wrong. My mental health is exacerbating. So you just kind of think about all of these things. And when you have a mental illness, it just adds to what's going on. Claire Bidwell has a book out and it's called The Missing Stage of Grief. And she's done a lot of work on really what should also be part of this is anxiety. Because you see anxiety throughout the grief process, the questions that go through your mind. Was my loved one in pain? Why did this happen? Why did they die? Why do I have mental illness? Why do I have schizophrenia? Did I do something wrong? Did I take drugs that made me go schizophrenic? All of those questions. What am I going to do now? How am I going to survive? How am I going to get a job? How am I going to serve financially? Where am I going to live? All of those questions just add anxiety to a person in a normal situation. And then if you think about it, schizophrenia is a condition that is exacerbated by stress and anxiety. So we have someone who is more susceptible to anxiety for their symptoms to go, and then we're going to put them through grief, which even adds and exacerbates their anxiety. So you're going to see more things going on. And the important thing to remember in doing that is when you go through that, to let them know that what you're going through is normal. This is okay. Grief and loss knock you off balance and turn your world upside down. This is your typical person that everything is wonderful in life and everything's stable, the white picket fence, you live the Hallmark life, everything. Grief and loss, no matter what it is going to knock you off balance. So let's add somebody who has their life is kind of uncertain, in housing, in security, in relationships, and all of that, who have psychosis, then it's really going to knock their world. And we need to be aware of that. Um, my sister has significant bipolar, and when my dad died, prior to that, she was working with him, and they flipped houses together. So he'd pick her up in the morning, and she lived in a house that he had bought for her. He picked her up in the morning, and they had coffee together, and they would go work together, and all of this kind of stuff. So her daily routine was part of him. And she's not married, and she doesn't have kids. So my dad died. And she called me a couple months later and she said, Lisa, she goes, I really think I'm going to have to be hospitalized. I just can't handle my moods. I'm just really having a hard time with dad's death. Things are going on. I think, I'm cycling. And I said, wait a minute, what's going on? Why do you think that? Well, because you got back in your life. You're okay. Everyone else, there's seven of us, everyone else is back to work and they're working. And I'm like, whoa, stop. You're right. I went home. I was able to get into my routine of taking care of my kids and going to my job and doing all of that. When she lost dad, she lost not only our dad, but she lost her landlord. She lost her job. She lost her morning coffee. She lost her routine. So her loss was much more significant and impactful. And she didn't have the strategies to get on with life. And I think we need to look at that when we're dealing. And I've had a lot of people with mental illness come to me and say, I've had this loss and I think I'm just going on with, I can't handle this. And I'll say, stop. What you're going through is loss. It's okay. It's not your mental health. You're not cycling. If you are, talk to your psychiatrist. Let's look at what's going on. But feeling this increased emotion, increased periods of anger and depression and sadness and not knowing what to do and anxiety, that's all part of the process. And even though it's been 6 months, a year later, it's part of the process. So just letting them know and sitting with them is really helpful. David Kessler is kind of one of the leaders in the country right now on grief and loss. And he worked originally with Kubler-Ross, and they did a book together on grief and grieving, which is really a pretty good book. But so he continues on the work, and he's kind of saying that actually there's a sixth stage with grief. Once you come to acceptance, the next stage is, okay, what's next? What's the new normal? What does my life look like? So, if I've lost my spouse, how do I go on with life? Where am I going to live? How can I do this? How do I go on without this person? Or if you have psychosis, so how do you go on and what does a normal life look like with psychosis? And helping to be able to help people go through and figure out the process on what normal is. Loss is very individualized. So we need to be aware that multiple losses are also impact pretty significantly. It can be the death of a loved one. It can be several people, losing grandma, losing a sister, losing a best friend, being diagnosed with a terminal illness, whether or not it is cancer or multiple sclerosis or psychosis. And then being diagnosed with MS on top of psychosis just kind of exacerbates everything that's going on. A chronic illness, having cardiac disease, having these things that prevent you from having the typical kind of life that everyone dreams of. Having a pet, someone with mental illness, losing their pet. I mean, it's hard for anyone when it's part of a family, but when your pet is the only thing that greets you, and the only grounding point you have and you lose it, it's hard and it's very devastating. Divorce and relationship breaks up, loss of an income or loss of, a job, knowing that you're never going to be able to have a job, a full-time job that's going to give me benefits that I'm going to support me. Feeling of loss of being safe. I'm never going to be safe again if you have a history of trauma. Selling the family home, which could be a basis of security for people. Miscarriage, infertility, um, loss of the white picket fence. I call the dream life. Everyone always imagined from being a little kid, I'm going to grow up and I'm going to do this and I'm going to do that and my life's going to look like this. And when you have a diagnosis, um, that changes. So that's a loss in itself. When you have psychosis itself, kind of like we referred to a minute ago, some of the losses, in general are loss of being normal. I'm no longer normal. I'm no longer typical. You got typical and neurotypical and all those words out there now, so I'm not normal. Loss of independence. I'm not going to be able to live on my own. I may need to have supports of a case manager. I may need to have to live with my family or in a supported residential. Loss of friendships. A lot of times people are like, you're just too weird. I can't handle, you know, your symptoms and your moods. And, you're talking to people. I can't handle that. Loss of family. Family pulls away. Loss of reality. What is real? It's a thought disorder. What is real? Loss of employment, loss of finances, loss of owning a home, especially right now. Not only owning a home, but finding an apartment right now is very hard. And the dream of being able to live on your own. And then loss of the Hallmark life. Again, everyone gets together on the holidays. We have a good life. You get married, you have kids, all of that kind of stuff is gone a lot of times. Some general factors to remember when we're dealing with psychosis that we've dealt with CBTP. It's stress-induced, exacerbated with anxiety, and anxiety is found in grief. So you can see exacerbation of symptoms and feeling unstable. Normalization, grief and bereavement challenges feeling normal for anybody. So you have somebody who is questioning normality and reality and all of this kind of stuff. Grief again, like with my sister. What's normal? What am I going to do? Thought disturbances. Psychosis is a thought disorder. So a lot of times you have paranoia, you have things, what is real, what's not real. Grief is a time to trying to figure out what's going on, and you can't figure out what's real. Nothing feels real anymore. If you have a trauma response, grief can be very traumatic, so it adds to it. And hallucinations and delusions are one of the key factors in psychosis. And in grief, there is visioning and grief psychosis, which kind of just adds to everything. Grief psychosis is, they've really found some research since the 70s in that they have found that it's not unusual for people to report when they have lost a loved one that they see them at home with them. They hear their voice after the death. Okay. So you're going through grief, and a normal thing could be to have some auditory or visual hallucinations, which someone with psychosis has all the time. So it gets very disturbing. Okay, why am I doing this now? What's going on? Do I need to go back and have my meds adjusted? It can be a normal process. Visioning is another unique situation in grief. Visioning occurs usually the last couple months to the last couple weeks before someone dies. You will see or notice that, or you will experience if you're actively, in the dying process, that you will see, hear, feel people that you love that has passed on ahead of you. You will have, I used to work at hospice, and, the wife is standing at the foot of the bed talking to them. Mom is there. I had a nurse who was an OB nurse who was dying and would talk about all of the babies that she had delivered or on the other side of the river waiting for her to cross. It's very real. I've had people who their cat that had passed is laying on the bed with them. So it's a very common thing, and um, it's not threatening. It's very peaceful. And a lot of times with hallucinations, auditory or visual, they're scary, they're disturbing. You're stupid, all of those negative things we hear. Visioning is very peaceful. It's loving. It's comforting. And the thought is it occurs as the people from are coming back from our lives that are helping us cross over in death. So it's a very peaceful. So helping people understand whether or not it's, you have psychosis and you see mom suddenly talking to dad who died 10 years ago, helping them understand what the process is and that mom's not right now psychotic. So those kind of things, just normalizing and helping them understand what's going on is very helpful. Um, Treatment considerations, if you look at treatment considerations, just about everything that we do with CBTP on the right side is what we can do with grief. CBT with grief is very helpful. It's one of the leading interventions and processes. The first thing is therapeutic alliance. We talked for both CBT and for grief, hear their story. Let them talk about what's going on, understand, let them feel it. A lot of time in my office, I didn't do anything more than just let them sit and cry, and get the grief out and talk about this loved one that they lost. Or if they've been diagnosed with a psychosis, the fact that, I'm not going to be able to have kids now, and I'm not going to, or I have a woman who had an abortion early in life who still cries. She's in her 70s because of her psychosis. That was her only chance to have a kid. So it's that grief and loss that she still feels. So being able to sit with her in that grief is very important. Cognitive restructuring. Again, we do this all the time. Change the negative down the rabbit hole into the positive. Like with my sister. Yep, I know this is horrible. You're having a hard time, but what you're going through is okay. You can do this. Let's get you through this and help them understand that they have the skills and that they can get through this. And a lot of what they're feeling is normal grief and loss. Again, normalization. Um, Normalize the psychosis, normalize the pain, help, that other people experience what's going on. And then from there, behavioral activation. Okay, this is your life. Where are you going now? What does life look now? These are the facts that you have. This is the cards you've been dealt. What are we going to do with them to move forward? The grief jar is it's a tool that I use and people love it. I love it. And historically, if you look at the top line, um, you hear people say, yep, your grief will go away. It'll get smaller and smaller and smaller and it'll go away. Okay? If you've lost your mom, or if you're diagnosed with schizophrenia, that pain and that loss is always going to be in your heart. It doesn't just poof go away, which again goes back to we don't want people to feel pain. So we kind of push it away. In reality, what our point is and what our goal is the bottom line. That pain is there. That loss, that hole in our hearts is going to be there. So what the challenge is and the focus is to build life bigger. How do you build your life around it? So that the loss doesn't take up every breath we take every day. How do we go on? And that's the challenge. And this is a great visual for people to see that, okay, it's there, it's real, it's okay that it's real. Now I just need to go on. Journaling. Journaling is a strategy technique that I have done, and I can see this being very effective. And it's different than okay, just journal every day how your life is going. What I've done is people, and we can adapt it for psychosis, but we've done it for loss. this is a journal. There's things I wish I would have told mom. There's things I need to tell mom how that, or dad, or, my sister. So people have gone out and they've bought a special journal just for their best friend that reminds them of them. And they write in there specifically on how life is going, everything that they would want to tell them, everything related to that person, how they're moving on, how things are going. So so it's more than just I had a bad day today and I went to the doctor and all of the kind of journaling things that we do, but this is more specific to the loss. So when it comes to psychosis, it's like how am I dealing with being I had they came today and they were talking to me today and they were telling me to hurt myself today and journaling specifically. And when they came and they did this, this is what I did. And I was able to manage it. So being able to write down and have this journal specific regarding the loss and how you're moving forward and it's your journal plan of moving forward. And it's a great way for them to see the steps that they're doing to release and to get out and to acknowledge the pain and the thoughts and everything. But then you can also look back and go, okay, I've moved forward. This is where I'm at. And this is my plan. Yeah, I'm thinking today of, moving to South Carolina, and this is what I can do. Put all of that in on how you're moving forward with life. The final thing that I use, and this is a book, The Invisible String by Patrice Karst. And I originally came across it as it's a great kids book. It's got great illustrations. I have found that this is great. It's a great book for kids. And it's a great book for adults, and it's a great book for families, for the death of a lost one, but also for people who are feeling isolated. Because it talks about in life, we're all connected by our loved ones by an invisible strings to our heart. And when we're away and we feel and we think of that person and we feel that little tug in our heart, it's them thinking of us and it's the connection that we have for them. So and it talks about that no matter in the world, whether or not, and it goes into kids stuff, like no matter if you're, cave diving or, an astronaut in space and all of these kind of things. But it also talks about like Uncle Bill, who is in heaven, that they're still there and we're still connected. So it's a great way to kind of reinforce that we're not there. And then you can use this to help people identify the supports and the grounding points that connect us all. How do you connect? Who is in your life that you're connected to? Who do you have strings? And it's a great way to go that way. Another variation on here, and I don't have an illustration, is kind of like a family tree kind of picture where you're all connected together. Who is the family, who's in your family? Who is connected in your tree that's your supports? Who do you contact? Who keeps you grounded? So that's kind of a little bit on grief and psychosis. I have some resources in here. There's some really good ones. The books are in here. There's some articles on here on grief and psychosis. Also grief.com is a website that has trainings on it. It has resources on it. It has worksheets. It has a lot of different things to use for grief in general that's easily adapted to whoever we're working with. And that's all I have.
Val, you're muted.
Every time. Thank you so much, Lisa. That was an amazing, really lovely presentation on grief. It brought to